Hi, my name is Kelly Hammontree, and I'm the coordinator of the sonography programs here at Harper College. And I welcome you. And my goal today is to give you some more information about the sonography program and also a little bit of information about the career of sonography so that you're able to determine if this might be a good career choice for you. At Harper, we have two ultrasound programs. We have the Diagnostic Medical Sonography and the Diagnostic Cardiac Sonography programs. The Diagnostic Medical Sonography program teaches you to use ultrasound to image organs of the abdomen, the pelvis, the pregnant uterus, some small parts like the thyroid. In the Cardiac Sonography program, we teach you how to use ultrasound to image the heart. These are commonly known as echocardiograms. With both of our sonography programs, we feel like we go above and beyond. For instance, in the Diagnostic Medical Sonography program, we also train you in basic and advanced vascular sonography. This is because in area hospitals, the general sonographers are asked to do a lot of the vascular ultrasound imaging as well. And in the Diagnostic Cardiac Sonography program, we train you in basic vascular. This is because cardiology offices often ask their sonographers to perform some carotids and some upper and lower vascular work. Also in our cardiac sonography program, we teach you how to be a cardiographic technician. This is the person that performs EKG-related diagnostic testing, things like Holter monitoring, telemetry monitoring, and stress testing in the clinical setting. There are lots of benefits to being a sonographer. You can look through the bullet points, but I can tell you that our graduates who go out and work as sonographers absolutely love what they're doing. They find it challenging. They're constantly learning to keep up in the field and to keep up with the technology. And in the hospital setting, they're considered extremely knowledgeable and they're well-respected member of the healthcare team. Oftentimes, on the floors or in the emergency room, the team is waiting for the sonographer to arrive so that the images can be obtained, so that clinical decisions can be made. Helping patients is rewarding, and sonographers are well compensated. I recommend that you view the SDMS career video. The link for this video is listed on this webpage. There are some things that you need to consider, though, when choosing sonography as a career path. There are certain aptitudes that you need to bring to the table. The sonographer needs to be able to manipulate that probe to bring in clear diagnostic images. And this requires that they have good eye-hand coordination, manual dexterity. You need to have quick reflexes, an ability to visualize how these organs are lying in the body so that you know how to maneuver the probe to bring the images in place. The sonographer also has to have the ability to multitask. You're doing several things at one time. You're maneuvering the probe to get diagnostic images, but at the same time you're diagnosing the images that you see on the screen. If you see a pathology, you have to make decisions about how to interrogate it and what your next steps might be. Also, if you're going to be a sonographer, you need to be able to attend for long periods of time. One sonography study may last 45 minutes to an hour, and you have to concentrate on those images for that entire time so you don't miss anything. And then this is how your whole day looks. You'll be doing 6 to 8 to 10 studies a day, so you need to maintain that attention span for the whole day. Also, sonographers spend a good amount of time on their feet. The work is physical. You need to move the equipment throughout the hospital into patients' rooms. You may need to rearrange furniture, position large patients. So it is important that you have a decent level of physical stamina. Also, it's a repetitive use type of occupation. You're performing the same motions over and over. So there is a high risk of musculoskeletal injury in the field. So it is important that you have musculoskeletal health if you're looking at this as a career. And of course, you need to be comfortable with working in the hospital. You'll be exposed to wounds, infections, IV lines, needles, bodily fluids. The patients are sick, uncomfortable, oftentimes critically ill. So you need to be comfortable in that environment. A successful sonographer needs to be able to show empathy towards the patient. They need to be appropriately assertive and an effective communicator in order to relate well with the patient and the healthcare team, and especially the physician. There might be times where you're missing images that the physician wants, or the physician could be standing behind your shoulder waiting for you to obtain the images. So you need to be able to hold your own in those types of circumstances. And then, of course, you need to be able to discern fine detail, color, gray shades in dim lighting situations in order to see the screen, and you need to be able to have auditory acuity so that you can hear the patient's blood pressure or requests for help. Applicants often ask me the difference between a cardiac and a medical sonographer. Cardiac sonographers work in the cardiology area of the hospital. They are considered specialists, meaning that they know every pathology and thing that can go wrong with the heart. When they do an ultrasound exam, they're more likely to take clips or loops or movies of the heart because it is a beating organ, and the types of analysis are a little bit more advanced because they do a lot of hemodynamic type measurements. Cardiac sonographers are still mostly working day shifts. The people who find themselves interested in cardiac sonography maybe have had a family member with heart disease, or they're into cardiovascular endurance and fitness. Medical sonographers work in the radiology area of the hospital. They're considered generalists, meaning they need to have sufficient knowledge about lots of organs and the disease processes. They take mostly static images, which means still frames or pictures of the organs of interest, and medical sonographers have a variety of shifts available to them, both day and evening. Employers prefer to hire credentialed sonographers, and sonographers obtain their credentials through the American Registry of Diagnostic Medical Sonographers. So when you graduate from our DMS program, our graduates sit for their registry exam in abdominal and OB/GYN ultrasound. And when they pass those exams, they will have earned their RDMS credential, meaning they're a registered diagnostic medical sonographer. Our DCS graduates sit for the adult echo exam through ARDMS, and after passing that credential, they have the letters RDCS after their name, indicating they're a registered diagnostic cardiac sonographer. When looking at programs, it's important that you find a program that's accredited through the Commission on Accreditation of Allied Health Education Programs. It's important that you attend an accredited program because those graduates are allowed to attempt their registry exam just before and immediately after graduation. And this is important because employers are looking to hire credentialed sonographers. Those graduating from an unaccredited program need to secure work and work full-time for a year before being able to sit for their registry exam. In terms of salaries, the salaries are extremely favorable, as indicated on this slide, and the U.S. Labor Department statistics project significant employment opportunities through 2020. The local job market has been competitive, however, with employment statistics as low as 75% over the past several years. Some of those graduates have had to accept part-time work instead of full-time work. Of course, the employment opportunities are much wider if you're willing to relocate. It's important that you review the curriculums by clicking on the links found on this webpage. By looking at the curriculum, you'll see that you need to bring certain classes to the table as prerequisites. Then the remaining courses include some gen eds, like a speech or humanities and social science, and then we have a few courses that comprise our health science core, things like medical terminology or basic patient care. Any course that doesn't have a DMS or a DCS prefix can be taken ahead of time, and oftentimes students choose to do this because it lightens their load when they're in the program. But taking courses early does not guarantee your acceptance into the program, nor does it shorten the program once you are accepted. Looking at the program courses in the curriculum, you'll see there's an ultrasound physics course, There's also a host of sonography theory courses, lab courses, and then, of course, your clinical experiences. In the theory courses, we basically have you in the classroom and we're teaching you how to interpret and interrogate and quantitate ultrasound images. In the lab, we're teaching you how to acquire these images. We do utilize modern equipment and we pride ourselves on small group instruction. The student-to-teacher ratios will never exceed 3:1. And then in terms of our clinicals, we have a host of recognized urban and suburban hospitals, but please keep in mind there's no guarantee that your clinical would be necessarily close to your home. It is important that you recognize that the programs need to be completed as outlined in a 2-year period. And please notice that both programs include a final summer semester, which is for your clinical experience. Both programs are considered daytime programs, meaning you need to have yourself available Monday through Friday, daytime hours. In terms of the clinicals, the DMS clinicals start your second year, second semester, and progress into the summer for a total of 800 hours. The DCS clinicals occur that final summer semester for a total of 400 hours. Before a student goes in clinical, they will complete a criminal background check, a health physical, we do perform random drug screening, and we will ask the students to secure their healthcare provider CPR certification. It is important that you're aware of the essential functions to be a healthcare provider and to specifically work in an imaging career, so we will invite you to click on the link so that you can review those aptitudes that you need to bring to the table in order to be successful. If you're recognizing any essential function that you need to bring to the table that would require some kind of accommodation, we do strongly recommend that you would contact Access and Disabilities prior to applying to the program to see if that accommodation is reasonable. So who are the successful students? They're students who have discovered how to learn, retain, and apply large amounts of information. They're organized, they've developed successful study strategies and time management strategies, and they've arranged their lives so that they can devote large amounts of time to school. It's important that everyone at home recognizes that school needs to be the student's #1 priority, and it's important that financial arrangements have been made. We find that students at the most are able to maintain flexible part-time employment while transversing the program. We estimate that for every hour a student spends in the classroom per week, they need an additional 2 to 3 hours outside of the classroom to study and practice in the imaging lab. So if a typical semester is 15 hours per week in the classroom, that student would need an additional 30 hours per week to study. That's a 45-hour school commitment per week. So each student could then decide if they would have time to meet their other part-time employment or home and social obligations. The successful student also needs to be able to accept criticism, to maintain a positive attitude, to remain flexible and reliable, and to show respect to their mentors and show respect to this rigorous training process. And it's also important that the student is able to accept responsibility for their own learning. Due to the high cost of equipment and the small group instruction, you'll notice that the DCS and the DMS courses are at double the standard tuition. Of course, you're only charged per semester as you move through the program. The program begins every fall semester, and typically we accept 18 students into the Diagnostic Cardiac program and 16 students into the Diagnostic Medical program. It is important to note that preference is given to students who live in the Harper district and also to students who live in one of our affiliated districts. Here you'll see a slide that indicates those districts that we have these affiliated or cooperative agreements with. Some of you may be out of district and wondering if there is a chance for you to secure a seat in one of our programs. Historically, it has been difficult for out-of-district students to obtain a seat in the Diagnostic Medical Sonography program, as it does remain very popular. But most years we are able to accommodate out-of-district students into the Diagnostic Cardiac Sonography program. For additional information on both programs, I'll encourage you to click on the links so that you can view all the documents on our web pages. And if you discover that you have additional questions concerning the academic program or the career in general, I welcome you to contact me at my Harper email. However, if you have questions that relate to the admissions process, I would encourage you to contact the admissions processing office. Thank you so much for your interest in the sonography programs at Harper College. Please take time to review the PowerPoint, clicking on all of the available links for important information. You should review things like the curriculum, the essential functions, and view the career video. If you have determined that you would like to pursue the sonography program here at Harper, I'll encourage you to click on the admissions link for next steps. After looking at all the information, if you've determined that sonography might not be the choice for you, I encourage you to click on the link so that you can review other health career options here at Harper College. Thank you so much for your time.